Good morning, Kaweah Delta. My name is Deborah Volison, and I'm the Director of Community Engagement here at the district. Today is Friday, June 12th, and this is our 10th Employee Huddle. And like we say every week, the goal of these huddles is to keep you informed and up to date on this rapidly changing healthcare crisis and the policies and procedures around COVID and the hospital in general. But we are here today to answer questions that have been submitted throughout the week. But I want to remind all of you that the chat lines are open and you can chat or comment at any time during this live webinar, and we will try to respond to your questions or comments. So the recording of this webinar will be posted in the employee portal later this evening. A few weeks ago, we thought we only had to worry about the COVID crisis, but the last 2 weeks have presented some additional challenges. And we hope that you will remember during this time of uncertainty and stress that our HR team can get you the resources that you might need to help deal with the additional emotions that are gripping our nation and our community. We applaud those of you who are working on the front lines and continuing to care for our patients and the hospital during these tumultuous times. But whether you're working from home and trying to balance your job and your family, or if you're coming in and working at the bedside of some of our most vulnerable patients, we are proud of the job that all of our teams are doing here at the district. Today, I am joined once again by Diane Cox, our Vice President of Human Resources, and Carrie Noweski, our Director of Care Management. Sorry, Carrie, I messed up on your title, but I'm going to go behind the camera at this time and welcome Carrie and Diane into the room.
Thank you.
Welcome
Deborah.
back. It's
Yeah,
good
good
to
morning.
see both of you.
Oh,
Okay, let's get situated here. Can you believe it's our 10th employee huddle?
the only reason I can believe it is because I know it's day like 93 of our command response. So,
Wow,
yes.
isn't that's
Yeah.
amazing? And I want to just thank you both for taking the time to come to these and to answer our employee questions. And we do get feedback from our employees, and they say thank you so much. These huddles are helping us so much. So I just want to say thank you to both of you.
Our pleasure.
And welcome to our 10th huddle.
Thank
Okay,
you.
Carrie, I'm gonna start with just something that blew up my social media this week, and people were sharing it and saying, we knew you didn't have to wear masks. So it's when the World Health Organization came out and said, you know, there really were unsure about asymptomatic spread.
Right.
Then they tried to retract it a couple of days later and say, well, we're a little unclear.
Right.
But what are your thoughts on the statement that they made?
Okay. So my thoughts and my opinion from obviously 90 days of COVID response, and then this extended just trying to work through all the recommendations that come out. The World Health Organization and the CDC both have a lot of information coming into them. They are making decisions and recommendations and have ideas based off of information that's coming through to them. And I believe that the World Health Organization, it was kind of a comment that there's this possibility that maybe people aren't as asymptomatic, that maybe the asymptomatic numbers aren't as high as we thought, and maybe the risk of spread isn't as prominent. It was almost a thought, an opinion, a possibility, because we know that we don't have enough data to know everything about coronavirus yet and all the pieces. It's just, we're just not there yet. So I think what they did was they misspoke in sharing a hypothesis that they didn't have evidence to support yet. What we do when we don't have conclusive evidence that the safest way to do something is we put in the highest level of protection possible. So we do that in healthcare all the time. If we suspect a patient has the flu when they come in, we put them in flu precautions until we know they don't have the flu. Because we suspect that they do. So until we know exactly what we're dealing with, we take the highest level of precaution versus the lowest level of precaution and just risk it. The benefit of putting the high level precautions in place is much greater than the risks of not wearing masks, for example. So could we come up in 6 months with totally different information? We absolutely could.
Or 1 week. No,
Or one
I'm
week,
kidding.
absolutely. As we all know, 6 months, it will be a very different picture. But right now, the highest level of precaution to keep people safe is masks. And there's not evidence to say that you're safe without a mask. There's educated guesses and hypotheses that maybe you don't need them. And I think that's probably coming from people not wearing them and not getting sick. But are they really in an exposed atmosphere? If you're outside riding your bike, you're not in an area where air is standing still around you and another person. You're not having prolonged exposure. You're moving past people. So if you were to pass on a path with someone else, even walking, that has coronavirus, and you walk by them, you're not likely to get it when we think about all the factors that are involved with the exposure, which is prolonged contact, no air exchange, close contact within 6 feet. Those things aren't happening outside. So people who aren't in a room with someone who has coronavirus for an extended period of time and aren't seeing the effects of it are wanting to believe that maybe it's not as bad as it seems. And it's good that we don't have half of our county positive and that people aren't seeing it. That means that our measures are working. If they aren't seeing it in their families and they're not seeing their friends become positive, that's good. That's what we wanted when we put social distancing and masks in place. So the CDC recommendations are significantly more conservative than anybody else, which is why we chose to follow the CDC recommendations.
We have been following the CDC recommendations
Absolutely.
from the beginning.
Yes, we have not faltered from that at all. We have continued to follow the CDC recommendations, and they do change, and we've made adjustments based on those. And then when they don't have a clear recommendation on something, we put the highest level of protection that we're able to into place.
Okay, thank you. So we're going to stay on masking a little bit. So a question, why do staff members think it's okay to wear a face mask that only covers their mouth?
I think because they are possibly uninformed or don't necessarily understand the risk of the nose being exposed. I think that they maybe just haven't heard it enough too. But everybody should be wearing the mask covering the nose and the mouth. And if it's sliding off your nose and you're repeatedly having to adjust it, then you need a different mask. You need to tighten the mask. You need to take the ear loops, get one of those extenders and pull it back further. If you have a cloth mask that's sliding, you can tie an extra knot in the ear loop so it is tighter on your ears. But constantly touching the mask and constantly rearranging it and moving it just makes your hands dirty, and then you touch surfaces. It also makes your mask dirty if you didn't wash your hands before touching it. So we all know we had bad habits of touching our face before this started, because that was the first thing everyone noticed when you were told not to touch your face. That rule still applies. Do not touch your face. But it's been 90 plus days now. So every time we do that, now we have these habits and these tics around arranging the mask. The mask is part of our body now. We've been wearing them so long. So now we're touching them and not realizing it. But that rule is still in place. Before and after you touch your mask, you should be washing your hands. Because the theory behind the mask is it's stopping the particles from getting into your mouth. So the particles would be on the outside of the mask. So,
Deborah, there was a story on the news this morning about a hair salon where the two stylists were positive COVID, but had taken care or had seen 140 customers while they were positive. And the story was that none of the 140 clients turned up positive. And the reason why the news story, the conclusion was maybe a little bit of luck, but also that there was complete masking and sanitation and hand washing that occurred. So the conclusion was that masking works if people use it consistently and appropriately. I just think that story reinforces the need, the requirement, the reason why we have mandatory masking.
Yeah,
It was
thank-
interesting.
Yeah, that is. Thank you
Yeah,
both.
yeah.
And they're also becoming quite the fashion statement.
Oh, yes.
I've been
there's-
seeing Starbucks
Oh, yes,
masks
yeah.
and glitter masks, and we can get them
Yeah.
to match every
I
outfit,
know.
right?
So, kind of on that note, since I have you here, please be conscientious to our dress code with the masks. So we still aren't advertising alcohol on our masks. No Bud Light masks or Corona masks or anything like that. I think I just advertised alcohol, but sorry. And be conscientious to who's looking at it. So, like skull and crossbones, when you're looking at a patient, probably not our best picture that we want to put out there. So I'm all for the fun designs. Mine's a Star Wars one. It's really cute, and I've been wearing it basically since day one. I have washed it every day, but it's okay to express yourself with it, but please be conscientious to who our audience is, our dress code policy, and those pieces too. And then I guess if you see someone with their mask below their nose, this is where step outside your comfort zone and be the one to educate them. If you see that happening, say, hey, don't forget, you got to put the mask above your nose. If they choose not to listen to you, they're putting themselves at risk, but they're putting others at risk. So then you're going to want to follow up with somebody to enforce it further. But it's okay to remind them and say, hey, I'm watching this. Because remember, if you walk past something that you see and you know it's wrong, you just told them it's okay. So just a little bit of a leadership plug there, because we're all leaders on this, is to just tell people, hey, don't forget, pull your mask up,
Okay, thank you. So this question came in from an employee, yet it also was discussed at our community meeting yesterday. So several private physician offices, people are going to them, nobody's wearing masks, and they really wanted to know, is Kaweah Delta working with the individual physicians' offices? I know you can't force them,
Right.
but what are we doing with our local physicians to encourage masking?
Right. So actually, about a month ago, we put together a toolkit. We call it a physician office toolkit, and our community physician liaison team took it out, and it was basically, here's what you do to protect yourself. Here's the cleaning. Here's the concepts behind the mask. Here's some materials you can give to your patients when they come in. Here's materials you can share with your staff and explain to staff the importance of the masking. So we have shared that with community physicians. Every Kaweah Delta office, like owned office and clinic, and everybody that we're affiliated with is following our standards of universal masking and the hand washing. And when patients and visitors come into the building, we expect them to wear masks too. That is across the board for all Kaweah, and that is an expectation that we can enforce. But with the community providers, we've tried to give them as much information and knowledge. So anytime a provider calls, we spend time talking with them, walking them through, even talking about asymptomatic versus symptomatic, and just giving them as much knowledge as we've gained. Because I think a lot of people, they haven't thought about it till it hits them. And so, in some of these smaller offices, that can really debilitate their whole team.
Okay, thank you. So Diane, we started phase 3 today, which means that our beloved lifestyle center. Now this is, employees have been asking, the community has been asking, and it opened today at 4:30.
Yes.
So let's go over some questions that have come in regarding the lifestyle center. So when the gym reopens, will Zumba classes or other group classes be available?
So I reached out to Patrick Tazio, the director of the Lifestyle Center, and he shared with me that group classes like Zumba will not be able to be offered initially, but once we get into phase 2 of the reopening in July, hopefully.
Okay, so let's talk about what is open and what is not open at the Lifestyle Center. So the workout equipment is open. They've kind of spread it out. But team sports like basketball, volleyball, those are not, correct?
Correct. I think this has been in the district daily.
It went out in the News You Can Use,
News You Can
and it
Use.
also went out probably in the District Daily.
Okay, so just as a reference for a lot of detail, try to pull up this document. But what it indicates is the track is open with physical distancing. The gymnasium is being used as an exercise area, so not basketball or volleyball, but an exercise for exercise. The lap pool is open for lap swimming with a 30-minute limit, one person per lane. The warm water pool is open for independent exercise. Jacuzzis and saunas are closed. Water fountains are unavailable, and childcare is closed right now. So that's phase 1. And then phase 2, hopefully in July, phase 3 then later on.
Okay, perfect. So with the showers not being available, an employee wants to know if they can opt out of the membership without a penalty because they have to use the Lifestyle Center during the day, which they would need to shower there.
Yeah, so Patrick shares that they are allowing members to cancel without a 30-day notice right now, or place the membership on a 2-month freeze, which would be July and August at no charge.
Okay.
So it's really being accommodating to
Right.
employees and other members, public,
Right.
in the reopening phase.
Right. Okay, fabulous. So we were all very happy that that
Very happy.
opened today. Yes. Okay, Diane, let's talk about PTO. We had a question regarding the PTO cap. How long will the extension of the PTO cap be in effect?
Okay, so a little bit of background. In mid-March, we received some questions from individuals who were at or close to the accrual cap of 400 hours of PTO because they were going to be unable to take time off to keep under that cap, and they would start to lose accrual. So in early April, we announced that we would extend the cap to 500 hours to allow people to continue to accrue. We have this pay period about 54 employees that are over that 400-hour cap right now. So the cap's going to revert back to 400 hours on June 28th, so just a couple of weeks from now. But anyone that has hours over 400 will retain them. They won't be removed, and they'll retain them until they either do a PTO cash out, which is coming up on the July 3rd paycheck, and many of those 54 people elected to opt into the PTO cash out program in December of 2019 for calendar year 2020. So I would imagine many of those 54 people will cash time out, or they will take time off, but they won't lose the time at all. They just stop accruing. So it's important that everybody looks at their pay stubs. The PTO accrual amount is on there to see if they're approaching the 400 hours or over, and start to make plans to cash out or take time off. We don't want people to stop accruing their time off. It's so important for people to take that time. People have worked very hard for 93 days and before that, and will continue to do so. But it's summer, and people need to recharge a bit and take a day or long weekend or some time off.
Okay, thank you. Carrie, regarding the COVID testing, can you please speak to the push from the Tulare County Health and Human Services for everybody to get tested for COVID-19, whether they have the symptoms or not? 2 days ago, they stated this testing is important to help us meet our state metrics. If we get tested today and it's negative, that doesn't mean we can't get exposed and test positive in a day or 2 to 3, correct? What is Kaweah's recommendation on asymptomatic testing?
Okay, so a couple of pieces in there. The county, yes, the county has a goal to try to get as many people tested as possible. And that's because not so much to identify the negative people, but to identify those positive ones that are out there and get them isolated. And the more you isolate and identify people that are positive that didn't know they were positive, the more you're going to decrease the spread, which is what we've been, ultimately trying to do, was slow that spread. So that's really the goal of all of mass testing, is to find those people that are positive out there. But it doesn't change. If you're negative today, you could be positive in 2 days. That's absolutely true. But it's another step in the direction of, if we have the resources to do it and we can identify some people, then we can make an impact, even a little bit more of an impact. So that's the thought process behind the mass testing, is trying to find those needles in the haystack that are sitting out there positive.
Okay, but can I ask you, all along, you have to get a doctor's order to get a test.
Right.
It's not like asymptomatic people can just drive up to our Floral Street and say, please test me.
Right. And so that's the difference with our testing. While we support the county, we help the county, we're not one of their asymptomatic testing locations. We don't have the capacity to do that mass testing. They've set up, I should say sample collection. We definitely don't have the test kits to do it, but we also can't test or sample collect all those people either. We just don't have the resources to do that out at our Floral Street. So they have opened up collection areas in Dinuba and in Porterville, and are working to increase their specimen collection. Those are ones they might run some, but a lot of those they send out to the commercial lab, just like we do, for outpatients that are pending that can go home and continue to quarantine, because we just don't have an abundance of test kits yet. Our goal is to get that up there, and ideally we would love to keep our own testing in-house. We can make decisions faster. We don't have to wait on commercial testing results to let people know what to do, and we could test more people. But right now our own supply is still on a limited basis, so we're conscientious. So Kaweah Delta still does, when we use our test kits, it's symptomatic testing. When you look at the CDC recommendations for testing, they recommend first patients in the hospital that are symptomatic. That's the very first group that they recommend using the tests on. The next group is healthcare workers who are symptomatic, and then they kind of work their way through. So we follow again that concept of testing using our first priorities are inpatients who are symptomatic, and then our healthcare workers who we need to identify, and then we are using our supplies to create a even safer environment with returning to elective surgeries, which the CDC recommended. They removed the recommendation to not have elective surgeries. They said it's okay to have elective surgeries now, but to continue to ensure the community that we're bringing safe, healthy people into these high-risk areas where there's more aerosolizing procedures, there's more risk. We're testing those individuals before they come in too. But the county, yes, needs to focus on that state and federal guideline to test as many people as possible, and the goal is to identify as many positive people out there that we don't know about.
Right. Okay, thank you. And I'll just throw this in. Gary said at the community meeting yesterday, out of the hundreds of pre-surgical patients that we've tested, only 2 have been
Right.
positive.
Right.
So
It was like a less than 0.5% positive rate that came back of those procedures and surgical patients we've been doing since right before May 18th is when we started doing that.
okay, perfect. So the Employee Relief Fund, Diane, we did a big push for that a couple of weeks ago. So are a lot of employees receiving help from the Employee Relief Fund?
As a reminder of the eligibility of that, we originally set it for a full-time employee, if they were docked 24 hours in a pay period, they would receive, is it 24? Gosh, 36. 36 hours in a pay period, they would receive a portion of the equivalent pay back. For a part-time employee, if they were docked 24 hours in a pay period, they would receive a portion of that time back in money from the relief fund, assuming that they had less than 8 hours of accrual. As it turned out, the docking was widely distributed, and we didn't have a lot of employees eligible for it. On average, I think 8. Far fewer than we expected. So we have done an analysis, and I'm pretty confident it'll be approved by the executive team on Monday to look at the 5 pay period total of docking that's gone on by employee. And for those that have docked significantly over that time, there's about 250 employees. We're going to give them some PTO back. And that will use up all of the funds that have been donated, which is around, Liz Wynn, the director of foundation, shared with me this week, it's around $100,000 that has been placed into that fund. And so that will provide for all of that to be redistributed back. So more next week. I think we'll be able to help about 250 employees with that, giving them some time back.
And that makes employees feel really good about giving. That's fabulous.
Yeah.
Okay, let's move to the antibody testing. And I just want to say, Melissa just put a post up there. Melissa, I'm sorry, I can't remember her. Melissa Sutherland, saying, good job, ladies. And so thank you, Melissa, for that.
Thank you.
Diane and Carrie, we are enjoying all of the positive feedback that is being sent in. So thank you, Melissa. Okay, let's talk about antibody testing. Will the employee antibody testing results, both positive and negative, be shared with staff? And will it be informational, not personal identifiable information?
Right. So yes, once we have a good number of people have gone through the testing and have kind of a good, I guess it's not a sample group, but along those lines, then yeah, we'll draw some conclusions and we'll publish that in a news you can use for people to just get an idea of where it's at. We will not share any identifiable information. We won't share where people work, that were positive, anything like that. It won't be along those lines. It'll just be conclusions that we can draw from what we found out. We've had probably close to 1,800 people do the testing so far. And we've got a few more weeks. We were doing about 200 or so a day. So that's a good number of people getting blood drawn each day through our sites, and appreciative to the lab and urgent care on Demery for making that happen. They just kind of shifted things around. It's not additional resources, it's resources that are already there, and they're doing those draws too. So that has really helped us be able to get this out to people.
Okay, so one of our employees, they want to know, well, a couple of them want to know how accurate the antibody test is. So one employee said, if I had COVID in January, would it still be positive now, 5 months later, or are they able to know that information?
So I don't know that I can say yes or no, like how do I want to say this? Antibody testing is interesting. We don't know enough about it yet, which is why this data is really important. Antibodies in general don't always stay in our system either. So that's why when we started doing the antibody testing, really the only information that you can derive from the antibody testing right now is if the antibody testing came back positive and you didn't know you had COVID, now you know you had COVID. That is the only definitive answer at this point in time that I'm aware of, and I know there's smarter people out there than me with this, but so if you had symptoms in January, thought you had it, but 5 months has passed since you had antibody testing, or some of our folks who had it last fall, your antibodies could still be there. They may have died off in your body because they didn't need to be used anymore. Or you might not have had COVID at all and had some other virus in January, which is all of those are possibilities. So I know that doesn't necessarily give you a definitive answer one way or the other, but we know that antibodies, some people can retain them a long time. Other people's bodies, they say, I don't need you anymore, I'm going to get rid of you because I don't have to fight this infection right now. So that's also why we can't sit there and say once you've had COVID we don't know if you can get it again or not. So if you were positive COVID, you're still wearing a mask just to protect you and keep you safe.
Okay. So let's go back to the COVID testing. Are the tests that Kaweah Delta performs, are those results reflected in the numbers that the county reports each day?
So I thought yes, but I did find out 2 weeks ago the answer to that is no. They reflect our positives, so the county numbers do have anybody that we come up as positive that is reported to the county, and that's a requirement that was in place before this. We report all communicable diseases and numbers to the county. So the positives are there, but they do not collect and report all of our testing and our negative numbers. And I don't have an answer as to why, but I can see the why in your eyes. It seems like it would be helpful if they're trying to do mass testing to use our testing numbers. But if you look, the county has about 4,000. The county has about 4,000 or so, I think, tests collected, and our numbers are pushing 8,000, so they're not reflected there.
Interesting.
But we'll continue to work with the county and see if they would like that information to put into their denominator, because I think that would really help with their testing.
Okay, why are we only reporting, and Diane, you might want to jump in on this one too. Why are we only reporting positive employees weekly now and not updating them on the dashboard each time it's released?
So we kind of had an idea, and we have to probably update our graphic that we do with the dashboard, like with the clinical snapshot. We kind of had an idea that we could show weekly, the number of weekly cases, like people that became positive in that week, to give a little bit more perspective to what's happening. Because if we keep reporting a cumulative number, it doesn't really show you much of information, how many people became positive in what weeks. So we've developed like when we went to weekly, we kind of intended for it to show you this was how many in the week of 315, 322, 329. So we have developed that. We need to integrate that, and I think that will make more sense as to why we're doing the weekly reporting instead of the daily reporting, just to give you a better picture. Because as we move forward and we return to different operations, COVID will still be something we have to report on daily, and we're going to have to track information and share information with you, but we also have to balance it with the work that has to be done in these different teams. So that was one of those numbers that we could do weekly and have the same information and impact. So what we want to do is show you each week how many people became positive and how many recovered and how many were hospitalized in that graphic. So we'll get that out and publish everyone. We have it developed, but you just have to hand it over to the people that make it look pretty.
Okay, so on the 27th of May, the clinical snapshot showed 71 positive employees. Then on the 29th, it dropped to 43 per the snapshot. Was
Right.
that an error?
That was actually just showing who was positive right now. So again, 71 was the cumulative number of all the people that have been positive, and some people saw that picture as there's 71 sick people right now, and it was, so we wanted to give a better in the moment idea that 71 people have been positive, but 43 are currently off and sick and working towards recovery, which so that's the change of it was they're pending recovery because they've been diagnosed, and people have these different stages of the disease that they're in. Some are come up positive and had very mild symptoms and don't get worse. Others progress through it. There's more people out there that may be watching that went through this, but we saw around day 10, people seemed to get the sickest, and then some people it lingered a few more weeks, others a few more days. It's very interesting to watch how different it is for people, and so we wanted to show the different stages of recovery because some people might be sooner than others.
The other reason we changed to showing the number of employees who are they're sick, they're in recovery, was because it was right below the number of patients. And that didn't show total patients that have ever had it. It just showed the patients that have it today, that we have. So by showing, it was inconsistent. Some people questioned why the numbers looked different. So we went to the same format where we were showing just the employees that were in recovery. If you add that to the people that are recovered, then you have the total.
Yeah, so the next question was, does pending recovery mean employees who are COVID positive? And yes, it does.
Yes.
Okay.
Yes.
Okay. So with the number of positive cases rising, do you think Tulare County is experiencing a surge?
So we're not seeing a surge in the hospital. We are staying very steady between 20 and 30 patients. We had a nice little break right in the middle of everyone being really strict with the rules in May, and then things started opening back up, and we've stayed consistent between 20 and 30 patients. I think with more testing, we're going to see more positives. With the county opening up, we're going to see more positives. And it's all a matter of how people protect themselves and what they do. But it's not outside the realm of possibilities that we see a surge. because now we're opening up and we've got the summer. So a lot of the summer activities are outdoors. So even with things being open and people doing things outside, as I said earlier, the risk is lower of contracting it because you're outside, you don't have prolonged exposure, you're more active. But what happens middle of August, beginning of September? We go back to school. And we go back to indoor activities and indoor sports. Volleyball starts up. And then we have basketball in the winter, and then we have flu season. So all these pieces are considerations that we're not, even though the county's reopening, and it was a mental health and an economic health that we had to address by reopening the county. We still have to be aware that the health of our community is still at risk because the virus isn't gone. Could we see changes in it and more information? Absolutely. And when we see those, we're not going to stop paying attention to it just because the county is reopening. We're going to keep paying attention to it, keep on track of it, because it could be devastating if we're not ready for a surge or a wave.
So are we equipped to handle an increase in positive cases if those are combined with the normal flu season?
Right. So we are getting ourselves equipped for that. We are stockpiling our PPE. We're trying to get access to more and more test kits. We're making surge plans within the hospital. We have different areas we could surge to and different scenarios that we would use in different situations. And one of those conversations has been flu and COVID combined. And what do we do with that? We still need the bed capacity. So if our med surge and ICU and ICCU areas become filled, where do we go next? And we have to look at, we can't take a whole another 30 beds on another med surge unit offline, but how do we keep our patients isolated that need the respiratory isolation while making sure there's capacity for patients that are non-isolation and keeping everybody safe. So all plans it's just kind of a lot of if this, then this that are in place, and keeping the command center team kind of intact to be ready to make those adjustments and operations when needed.
Hey, can I go off script and ask a question?
Yes.
I've heard that one of the issues that we're having right now is the ability to discharge patients back to skilled nursing facilities or where they came into us from, and that's causing us to have kind of a backup in our acute patient care beds for patients who are ready to be discharged but we can't. Is there some insight you could provide about
Sure.
that?
So where the barrier was with the skilled nursing facilities was we had patients that were not prior in a skilled nursing facility now needing one. So we all know we had 5 skilled nursing facilities in town that had outbreaks of coronavirus, and for a period of time they were not able to admit patients. So our normal ability to take a patient who came in after a stroke or a cardiac procedure and they need a short-term rehab, or maybe they need a few more months of, because their family member or loved one can't take care of them, they would go to a facility. Our normal facilities were not able to admit, so they couldn't take these patients from us. So we were kind of waiting for beds to become available in the other facilities in town who were basically inundated with patients because of these several hundred beds that were unavailable to us. With 5 facilities, that was easily over 500 beds total that they all made up that would be discharge locations for our patients that need it. Where we're at now, it's better. So several of those facilities, 3 of the 5 can admit patients, and they all of them were taking their patients back. They were doing that. We just couldn't get new patients in there. Just a routine barrier that we have even before COVID, and I can't wait till we can magically solve this problem, is the need for long-term care and secured locked areas for our patients who wander or might wander off because they can't can't be with, they need those locked doors. We don't have a lot of those types of beds in our area. So those are some of our patients that we're sitting here waiting to. Fortunately though, that problem, what was here last week, we were actually up to holding 30 patients for skilled nursing facilities. Yesterday we were down to 10.
Oh,
Yes.
good.
And those were our ones that are kind of typical, even before COVID, that we would have to hang on to because we needed to find a long-term placement. And that's probably another hour lecture on
No.
long-term placement, but
We have a question that
Okay.
has come in on that, Carrie. So would we consider sending patients to the COVID facility in Porterville that the state built if we have a surge during flu season?
that is one of the options for the Porterville Development Center. And I actually was on the phone with CDPH, I think on Tuesday. I was talking with them about our need and that we didn't need it right now, but we would like to see that be available if we were holding non-COVID patients who need to go to a skilled nursing facility or needed placement. And between us, Sierra View, Tulare Adventist, if they needed it, to transfer patients to that Porterville Development Center. The pieces with that is the state would need help with standing that up. They don't actually have the resources to stand it up without support. So they would need policies, they would need computer equipment, they would need processes and order sets, they need an EMR or paper EMR, and they need staffing. So when we were having this conversation last week with the 30 patients that we were holding, we were definitely not willing to commit staffing to that. And our staff, our clinical folks that are on the call right now, know that we are tight with staffing as it is to take care of the patients in the hospital right now. So it made more sense now to work to get them into placements, but but yes, the state is acutely aware that that may be something we need to use it for. I did see on the front of the paper, though, that they're talking about putting inmates there, so we'll see. We're not going to help with that.
Thank you, Carrie. All right, Diane, we have a few questions about our remote employees. So what are the hospital's views as far as bringing more workers back from working remotely and how this affects direct patient care?
Yeah, I'm not sure I completely understand the question. So for the person who asked that question, if I don't answer it quite correctly, please send a follow-up question to us. This question is about bringing workers back and how it affects direct patient care. So the individuals that are working remotely are people in business office type roles. And I think it would affect direct patient care only if they were to become ill and hospitalized. But maybe, Carrie, you can help me with the question. Our priority with the remote workers is in bringing them back and making those decisions is about safety for all. Safety for them, making sure we have space and social distancing, making sure that their leaders are commenting on what is best for their service line. So I'm not sure I understand the question fully, but we're still going through the process of making those decisions. We originally thought July 6th might be the week. We are still talking about that at the executive team level, and that is subject to change, just depending on what we see in the next week to 3 regarding positive patients and positive employees.
So that's another question. Will the remote employees continue to work from home past the week of July? So we're uncertain about that at this time.
We are uncertain about that.
Okay. Is the hospital wanting more employees to work remotely due to the amount of employee positivity rising?
Well, we want to balance safety with productivity and with employee preference. And certainly the process we're going through right now is we have identified every employee that is working either full-time remotely or intermittently remotely. We know who they are, and we know we're learning from their leaders what their preferences are about them returning to work for whatever reason that might be. We're going to consolidate that into an updated report, take that to the executive team, and then we'll study it and see what makes sense. If we continue to see surges, if we continue to see a lot of positives, it might make sense to keep people working remotely. some employees want to come back. And we have started moving some employees back depending. It's just every service is different, every department is different, and so we're making decisions instead of it across the board based on individual departments' needs and preferences, and taking into account employee preferences in some cases too.
And that was another question. Coworkers are concerned because they feel like they can fulfill their job duties remotely. And so, just the fear of working in a healthcare system and environment. But you're considering all of that, working with the individual directors and managers.
We are. There may be some people that are returned on site that would prefer not to be. But for the right reasons, we may have to make that decision to make that happen. We certainly want to be very protective of people in high-risk categories that are immunocompromised systems or are older workers. We want to be very careful about them for sure. So we'll just continue to work through it, and I would ask any of the remote workers out there to stay close to their leaders in those discussions.
Okay, so the question came in, and you and I were discussing it right before the meeting. Is Kaweah Delta considering alternative work or schedule options for employees who are parents of school-aged children if the schools do not fully reopen in the fall?
It's a great question, and when we talked before the session today, I mentioned that I had not heard that question. I did hear a mention of a school district saying they might not open until January, but I didn't know if that was local or not. So it is something that we're interested in watching closely. I will say that many of our employees, especially in the clinical areas, work 12-hour shifts 3 days a week. So they have more flexibility to work around school schedules, especially if they are part-time when they go back to school. The bigger concern would be the Monday through Friday people that work the day shift and what to do if their kids go back to school on a part-time basis. So that is definitely something that I now am aware of that we have to keep our eyes on and work through as the schools hopefully reopen in the August-September timeframe. So thank you for whoever brought that to our attention because I had not heard that yet.
Okay, thank you, Diane. So a chat is around traveling and quarantining. So really, this is probably the first time we've been encouraging people to take vacation because travel is just now starting to open. So do we have to quarantine if we travel?
Yeah, there was a lot of discussion in March when we opened the command center and started communicating about quarantine, because travel was a big deal. That was the biggest deal then when we first started opening. We never did make quarantine a condition, though. We never said that we would quarantine employees for 14 days specifically on travel. We asked people not to travel to the hot spots. At that time, New York, New Jersey, that area of the country was heavily impacted. But what we did ask then and now is to self-monitor for, fever and cough and shortness of breath, and now it's loss of taste and smell and GI problems and blue toes and leg numbness and just self-monitor for any symptoms that you're aware of. And so there's no quarantine required for travel. Just be vigilant and careful and wear your mask and wash your hands and social distance to the extent you can at all times at work and in your personal lives as well. Like I said last week, we're the role models. Mm-hmm. We're the healthcare people that everyone looks to know all the answers and do all the right things. So please honor that role in our lives.
Okay, Diane, I have another question that's come in. Are layoffs expected now with the hospital financial situation?
Another great and very important question. Yes, I guess the short answer is yes. Our May financials were just published yesterday, and we have quite a significant loss from operations. We made some of it back in some of the investments. The money that when the stock market came back, some of our investments gained some of that money back. But we are operating at a loss right now due to the loss of revenue, and some increased expenses around the COVID pandemic. So our budget starts, our new accounting year, fiscal year, our budget starts July 1, and we are trying to do our best estimates with what our revenue projections might look like, what our expenses might look like, and there will be a gap, not being able to close that to even break even, to even get to zero. So just like in your home expenses, you have money coming in, you have money going out, and you have to get to a place where it's at least even, if hopefully you're saving a little money in the way. But we're at a point with this budget where we're trying to close the gap to get to break even, if not some operating margin profit. So in that process, we're looking at non-labor cuts, contract cuts, supplies cuts, anything we can do that won't affect the workforce. But in the end, there will be some layoffs. And those layoffs have started to occur already.
Okay, sorry, Diane. I was like, well, that's a bummer. Are we still in a hiring freeze?
It's the worst part of my job, certainly, and the leaders are as well, and some leaders are affected as well in this process. So we're looking. We've done a deep review with every vice president and trying to avoid everything we can, but in the end, it's reality not only for Kaweah Delta but for other organizations around us, including a local organization that already did layoffs some 6 weeks ago. So I'm sorry, I lost your next question.
You know what, Diane, I appreciate your transparency because I know that is very hard, and we have 125 people listening, so I appreciate your transparency on that.
Yeah.
Okay, Carrie, I have a few for you. And this one question, I left it as it was just because it kind of made me smile.
Yeah.
So this question is, our EVS staff is amazing, and I know they work their little buns off. However, have we now implemented having them clean, sanitize door handles, elevator buttons, high-touch surfaces in the main hospital, as well as our off-campus offices? Should other employees take that upon themselves to do that?
So, short answer, yes and yes. We have actually, there's one individual assigned in the main campus where they basically spend the whole day going through those high-touch areas, and then they just start back over again. And they just keep going through all those high-touch areas and wiping those places down. And then in all the other areas where our EVS team, as well as the contract teams, they've all been instructed to increase their frequency of wiping down those high touch areas, and they've provided them with that information of these would be considered high touch areas. And but I would encourage people to also frequently wipe areas you're in. So I know that when we talk about door handles, my office door handle probably doesn't get wiped down. That's my office. I'm going to wipe that down frequently myself with people coming in or out if I'm in my office. But I would recommend people take it upon themselves as well. It's not going to hurt for both. But yes, EVS has increased their vigilance with those high touch areas.
Okay, thank you. All right, we're going to go to the chat. So can the COVID antibody test detect if a person has COVID right now or only if they've had it in the past?
So it can only it only detects it if they've had it in the past, but as recent as 14 days since symptoms. So if you were symptomatic right now, the antibody test wouldn't tell you if it was COVID or not. But in 2 weeks, it is likely to tell you if it was COVID or not.
Okay, so what happens if an employee refuses the COVID testing? And I'm thinking this is the antibody testing.
Sure. Well, there's probably two things, so I'll kind of touch on both of those. The antibody testing, 100% volunteer, or it's up to you. It's optional. You don't have to do the antibody testing. And it is truly entirely up to you. We've got no requirement, and it again, like we talked about before, it only really tells you one thing, that if it comes back positive and you didn't know you had COVID, now you know you had COVID at some point in time. The COVID testing, though, there are groups of employees that are required to get tested now. So there is a CDPH waiver in place that office facilities letter, not waiver, I'm sorry, that our skilled nursing facility team members have to be tested routinely. So every skilled nursing facility in the state had to test a baseline test of all their employees and all their patients. And then going forward, every week, every facility has to test 25% of their staff. So our facility, we have 3 programs that are skilled nursing facilities programs, has about 200 people. So those people all had to go through the baseline testing, and then they'll basically about 50 a week will go through routine testing. In the letter, it doesn't say exactly what people should do about that, but what it does tell is that it's required that people are testing, so you'd have to have internal processes around how you manage employees that refuse to be tested. So our team would, the leadership in those areas would have processes around an employee refusing to be tested.
Okay, so does that antibody test only test for the COVID-19 virus, or will it show positive for other coronavirus strains?
Ours is specific for COVID-19, but there are antibody tests out there that would show other coronavirus strains too, because there is other coronavirus strains already present.
You know, I'll just add for the employee that does not want to take the test even though it's required to do so, I think the first thing we would do is try to help that employee with a transfer to an area where it wasn't required. But in the end, if that wasn't available and they refused to do that, I think they'd probably have to go on leave of absence until we sorted through what the issue was with them. Because it's a requirement. We don't have a choice. And if we don't have a choice, the employees don't really have that much of a choice either.
Okay, so Carrie, would Kaweah Delta still be implementing the safety practices we currently have now, even if we were to have a treatment for COVID?
So yes, because the treatment would be on like the other end of getting it. So we would still want to prevent our team members and our patients from contracting COVID and needing the treatment in the first place. So yes, we would still be doing these infection control measures that we have in place to slow the spread. Now down the line, and it could very well be a year from now, when there's a vaccine and we can see that the vaccine is effective in slowing the spread, then we could venture into less infection control measures in place. But until then, our source control is the masks, the hand washing, the social distancing, and the PPE in general to prevent the spread. And that's going to be the reality. And even if there's a treatment that's available, we don't want to inundate our team with being ill by saying you don't have to do the infection control measures anymore, because even if you get sick, there'd be a treatment. We wouldn't take that approach.
Okay.
Yeah.
So we have 4 more questions, and we're going to speed through these because we only have 2 minutes. Diane, when will volunteers be allowed back in our facilities?
Not yet. We value the guild members and our volunteers greatly, and we miss them. But many of the guild members are in high-risk categories. So I've been in touch with the president of the guild and a board member, and they're very aware of the delay. I think that they're appreciative, and they definitely understand it. So hospitals are not allowing volunteers back into the environment yet. We'll probably maybe follow the visitor policy a little bit, watch what the state and county do, but we're mindful of it. It could be sometime.
Okay. So, chat question. Do you know exactly what departments are going to be affected by layoffs?
Yeah. So we are being very mindful of this process. And we've met with each vice president who have reached out to their leaders. So in this first review, yes, we do know. I will tell you, because it'll probably be asked now, how many? are going to be affected, and right now the count is somewhere around 40 to 50 of our 5,050 employees. So while not a high percentage of our employees, it's 40 or 50 people that are affected by this. So we care about that. And the notifications will primarily be rolled out in the next
So
2.
Carrie, has Kaweah Delta
So Carrie,
thought about asking
has
and tracking
Kaweah
if
Delta
employees
thought
have
about
second
asking
jobs
and tracking
in
if
case
employees
there's
have
an
second
outbreak at
jobs
that other job
in
site?
case there's an
So
outbreak
one
at
of the
that other
first
job site?
all facilities letters that came out was that if you have a second job, you have to stay at one primary job. You aren't supposed to transfer from working at one place or another. So areas in our patient care, our managers in our patient care area should have sent that out to their team, say you've got to limit your working in other areas, but we have not. That's not something that we have actually tracked. No.
Okay, so are there any updates
Okay,
on
so
whether
are there any
antibodies
updates on
equals
whether antibodies equals
Sorry.
immunity?
Okay, well,
No.
thank you, and Carrie, if you would
Okay,
close us
well,
out.
thank you.
Sure,
And Carrie,
yeah,
if you would close us out.
You know, just thank you all for joining us. Thank you for the great questions. Thank you for trusting us to give you these answers. We know it's been hard. Every single person has a COVID related story, scenario. It's impacted your lives, and we understand that. We appreciate that. And it's okay to not be okay with it all the time. It really is. It honestly is. And everybody has those moments where you just want to sit back. You want to throw in the towel. You want to just say, let's just get it over with. I mean, what do we do next? And I'm sorry I can't make that go away. I can't make it go faster. I can't make it resolve sooner. We would love to. We would love to be done with this and move back into reality. Some of our struggles before seem not as big of a deal as they do right now, as the other things we have going on right now. So not only do we have coronavirus, we've got social injustice, we've got economy concerns, layoffs, and lots of things tearing at our hearts. So just remember what's important for you. Remember who's important for you. Take care of yourself. Take care of your families. Keep letting us answer your questions. Keep bringing us ideas and concerns. We appreciate that. And then just keep working to find what your normal is, and be okay with your new normal, and make those changes you have to, so that you can not just survive, but be happy and content with what this is. Yeah, I hate to say it, I do think we have probably 6 months to a year where we will continue in this state and find a way to function within it. So do everything you can to maintain yourself too. Thank you so much, everybody.
Thank you.